Do you have any front knee pain? Do you have any pain after basketball, volleyball, or running? If you do, this video will help you. A few days ago, I had a seminar with some basketball coaches in Shanghai, China. The seminar material was fairly similar to the one we go through today. At the end of the seminar, we did some simple tests to stress the front knee. I was shocked. Only 1 out of 20 coaches passed all the tests, but the rest of them had mild to severe pain in front of the knee. Also, my basketball teammates have knee pain on a regular basis. From time to time, they off the game and return once they don't feel the pain. But is it enough to control the pain and prevent future problems? How about the prevention for the future? Here's the truth about the tendon health. We need to load the tendon correctly. Otherwise, the chances you're going to have the related problem are high. We're going to talk about the general information about anterior knee pain. We're going to talk about how you need to address the different level of the front knee problem. We are going to talk about different factors that contribute to the knee. First, let's go through the simple anatomy of the anterior knee. Quadriceps connect to quadricep tendon connected to patella connected to patella tendon, and at the end of it, tibial tuberosity. These are combined together and work as a one unit, move as a prime mover for knee extension. Tendinopathy is a degeneration of the collagen protein that forms the tendon. Tendonitis is, on the other hand, is just inflammation of the tendon. Talk to your doctor if your knee pain is persistent. Knowing your status is always important. Don't run away from your problem. As far as all of the differential diagnosis of the knee, we will talk in future video. Let's go through some of the additional information. Regarding how many population has anterior knee pain, about 30% of the population has some level of knee pain. Probably if you're on a sports team, the chances that your teammate has knee pain are higher than 30%. Okay, we just covered basic information. I will talk through this problem with the deepest aspect to most shallow aspect in the neuromuscular skeletal system. Deep means more structural aspect and joint biomechanic perspective, and superficial means general muscle strength, balance, and length aspect. Many people overlook the ankle, pelvis, and hip for knee health. If any of them are not working well, either from subluxation of the spine, muscle weakness, or muscle balance problem, it will cause unnecessary stress to the knee joint. There are 80 different pelvic subluxation variants. Correcting pelvic subluxation is a matter. As you guys know, the femur head is connected to the ilium. If the pelvis is not working well, most likely your hip will not work in normal way as well. It will change the relative position of the ilium to the femur head, leading to changes Q angle from hip joint. It could make some biomechanical changes to the knee. It will make valgus and varus knee stress. At the ankle, it could make some inversion or eversion type of instability on the subtalar joint. In case of the ankle problem, it could make a similar problem just like pelvic problem. Normal biomechanical joint movement could be altered by the pelvic subluxation. Subluxation at the nerve root will cause muscle problem. Muscle activation will be not even side to side and front and back. If the subluxation is severe enough, some of the motor or sensory function could be bad as well. This is one of the example of my patient's AP pelvic film. Right is right and left is left. If the pelvis is not working well, naturally the muscles on the pelvis are moving in a strange way to adapt to the subluxated pelvis. It leads to muscle inactivity or overactivated muscles depending on subluxation. You should have good range of motion at the hip joint to reduce the major shock absorption from ground impact when you land, and also generate forward or upward or stopping motion. Otherwise, that excess stress goes to the knee joint. If your knee is not ready to absorb this excess energy, it will lead to knee damage. Usually the location is anterior knee. Of course, the knee joint also can absorb a large part of ground reaction as well, but it should be distributed with 3 different joints: ankle, knee, and hip. Unfortunately, in this day and age, having a functional normal hip joint is getting hard because of too much sitting. We're going to talk about functional hip in the future. As I mentioned earlier, the ankle should absorb a large part of the energy generated from your lower body, but also observe from the ground impact as well. If your ankle is not working well, typically limited dorsiflexion, it will lead to adding unnecessary stress to your knee. Let's talk about an example. This is an example of the ankle inversion sprain. The joint space is not even inner and outer side of the subtalar joint. As you can see, medial part of the subtalar joint is open related to the lateral side. It will make uneven foundation of the lower limbs. It will be more susceptible to another ankle sprain in the same direction. In this case, the possibility of the evergent sprain will be higher. How this ankle sprain affects the knee? Once the ankle is sprained, usually the talus will be shifted toward the front and upward. Most ankle sprain cause subtalar misalignment in this direction, which will limit ankle dorsiflexion. If you are curious about how to make your sprained ankle strong again, please check ankle sprain video. One of the most easiest way to check your ankle dorsiflexion is 6-inch method. If your foot is planted 6 inches away from the wall, but your knee is not able to touch the wall without your heel off the ground, most likely your ankle is adding more stress to your knee. Let's talk about the knee joint itself. As you guys already know, major knee movement is hinge move. Of course, tibia could rotate inward and outward. There is various way to get knee subluxation in two different way, mainly rotation or anterior or posterior or both, all of them combined. Usual confirmation method is standing AP and lateral x-ray. Now let's talk about the general strength and balance. If you are too weak to handle your body weight, whatever you do, it will hurt. Muscle mass itself is one of the most important factors for longevity. Everyone should try to maintain or increase muscle mass for their health. Let's talk about balance. The ratio from the quad versus hamstring is really important for knee health. Especially the quad is too dominant to the hamstring, highly likely you are going to get ligament or tendon problem. It will cause more unnecessary stress to the anterior knee area and hamstring tendon as well. Similarly, anterior tibialis and calf muscles should be considered as well, but we don't know the actual ratio yet. But if you have limited dorsiflexion, most likely your anterior tibialis is not working fully. In this case, a previous ankle sprain or too much dominant calf muscle or stiff calf muscle can contribute to this. If you've never been to strengthen anterior tibialis but only calf muscle, please strengthen the anterior tibialis. Your knee will be pleased. Finally, we are talking about the rehabilitation process of the anterior knee. What we are mainly talking about is tendon recovery in this video. Originally, patella and quadricep tendons are extremely strong structure. Patella tendon can endure 15 to 19 times of your body weight when you jump. Quadricep tendons is even stronger than patella tendon. But how come this strong structure can have tendinopathy? What is the usual causation of it? We used to think it mainly comes from overuse, but recent study do not really support that. It is more related to unexpected stimuli. What does it mean? It means it doesn't matter if you're an Olympic gold medalist or not. If you're off from the training for 2 months and back to the original training intensity and volume, you have a significantly high risk of tendon injury. Sudden increased training volume, intensity, and lack of resting time, all of them are contributing factors for patellar tendinopathy. When it comes to the rehabilitation of the patellar tendon, we have to load the quadricep. So quadricep tendon, patellar tendon, this one unit can be strengthened throughout your rehabilitation process. If you start anterior knee rehabilitation, you have to strictly control intensity, volume, and resting time. Based on my observation from working as a team doctor before, resting and limiting physical activity is the hardest aspect mentally for athletes. But for the weekend warrior type people, your anterior knee pain mostly comes from the general weakness and unregulated workout intensity setting and resting time. Please have a properly scheduled workout and sports game time. If your sports give you a lot of stress, your body should have enough conditioning for that specific stress. Unfortunately, the tendon rehabilitation process cannot go faster than your body's adaptation to the rehab exercise. If you push too fast or too strong, you will pay with the most limited resource in the world, your time. You have to go back to lower level, maybe the first step again, climb up the normal level. I know it sounds really boring and painful mentally. Yes, it is. I will not lie to you guys. Before getting into the actual rehabilitation process, we need to know which stage you are in. Here are 3 different stages of ligament damage: reactive, this repair, degenerative stage. First, reactive stage. Usually patients present having dual pain, maybe a light pins and needle type pain, swollen thickened tendon due to the unexpected loading. Usually in this light damaged stage, resting for a week or 2 weeks off training will be enough to go back to your training or sports. If you keep pushing your tendon's limit and accumulate stress, you will reach the second stage. If you have pain at the front part of your knee more than 2 weeks, probably you are getting into the disc repair stage. You might need to rest a few days to 2 weeks for any type of sports or training. Plus, you need to go through the few levels of rehabilitation exercises or all of them. If you have a biomechanical problem and it is not able to return to normal by patient's will or instructor, the chances you have different type of the problem together are high, like pelvic or ankle or knee joint itself or general muscle strength level balance. Depending on how bad is the damage, you need to start from the various different points. The last phase is degenerative phase. If you're in this stage, you need special care by using modality, medication, and maybe even surgery. Even if you have done a certain level of the special care, you still need to have a rehabilitation process depending on how much activity level you want. In this phase, your tendons start to change to cartilage-like tissue, which means your tendon's intrinsic function is changing to different function. Not a good thing to have. How to rehab your knee? Most likely you need to follow this isometric, isotonic, eccentric first, and concentric, and plyometric. All of the exercise video will be posted in the next video. Isometric exercise will decrease pain and activate muscle back online. You need to keep increasing intensity with steps. Isotonic phase, once you are okay with the isometric exercise, you need to start with eccentric exercises to stress tendon in your knee. Use eccentric muscle contraction with descending squat and use a cane or pole to ascend upward. It will keep decreasing pain and increase the strength of the tendon. Once you're okay with eccentric exercises, still fully utilize eccentric contraction for training. Once you're done with using eccentric and concentric exercise, slowly apply plyometric exercise. Once you reach plyometric, if your knee can handle single leg plyometric exercise, you can slowly get into sports activity. Make sure you have consultation with the doctor and confirm the diagnosis before. The next video will contain exercise steps you may want to use. Intensity, set, and resting time are given. If you do things correctly, you should have full recovery in 2 weeks to 3 months. Yes, it is a long and tedious process, but your body will adapt to the stress. There is no way to run away, otherwise there is no healthy tendon health. Cold hard truth, patience, and continuous loading are key. I hope all of you guys are free from the front knee pain, running around playing sports with friends, playing with the family without any knee pain. If you have any question, please put down the comments below. Until next time, stay healthy.